And we are going to, you can have your animal either standing. Standing's okay, but I find if they're lying, it's going to be easier because the muscles are going to be more relaxed. Yeah, but if you can only work with a standing animal, it's better than nothing. Cool. So we're going to start by doing anfa along the hua toe point. So the hua toe points are basically just either side of the spine. So they're 0.5 chun out from the side of the vertebrae. So we're going to be doing anfa, pushing just up the hua toe line. Cool. And I usually work from tail to head, from caudal to cranial.
Yep.
And it gives you a chance to get a feel for the muscle in the animal, to get the dog comfortable with your touch. Cool. And you could spend 3 minutes, you could even spend up to 5 minutes doing this. Just, yep. Either side, so the hua toe channel goes directly up here, either side of the spine. And the hua toe is really good because it's where the nerves feed out from the spine, so you're just applying a little bit of pressure on there.
So you can do one side at a time?
Yep. Or you could do both. Yeah. You could do both. You could pinch either side. So we're just doing anfa, gentle pressure. Oh. So going up and down there. And then we're going to do nifa. So that's the pinching. This is just pinching the skin, so on a more of a superficial level. And again, I always go from caudal to cranial. You guys remember this?
Yes.
Yep. So going on the governing vessel, which is the channel that goes directly on the spine. So today we covered governing vessel 14. So there is a whole channel that goes down here. So an energy pathway basically travels directly on the spine.
So the pinching is actually on the on the spine that you're doing.
On the spine. Yeah. So nifa on the spine is really good for IVDD. It's good disc issues. Yeah. Causes a lot of vasodilation. Yep. If you do feel any areas that are a bit like tighter, sticking, you can give it a little tug and just free it up.
And you said like this would be like the equivalent of some sort of like a fascia.
Myofascial, yeah. And it's up to you when you start working, whether you work on the floor or on a table. A table is going to save your back. Yes. Take it from me. Yeah. After years and years I still work on the floor. I just feel more comfortable in my, like, in how I work. But my back is not happy with me for those life choices. But that's okay. I only say that because as you see me leaning over, if you have a table and you have them level, it's a bit easier. Yeah. So I'd be going up and down the spine, say 10 times. Yep. So that might take you again, another 3-4 minutes. So you're almost 10 minutes into the massage. Time can just, it's not as hard as it may initially seem. Once you start, you'll find you probably will run out of time. Cool. And so then we are going to do some tuifa. So I don't know if you remember, tuifa is the pushing.
Yes.
Yep. And I'd never start with this technique because it's strong. Yeah. Again, this would be like.
And are you doing it slightly off the spine there?
Yeah, I'm not doing it on the spine. I'm doing it on the muscle. Yeah. So
this
again is myofascial release. And again, you could do both sides, say 10 times. Yep.
You can see it twitching along there, isn't it?
Yeah. She's very good. It would feel nice though. Yeah, and we've built, we've worked up to it.
She likes you, so it's...
Yeah, we're friends. We had rapport. And then we're doing Dianfa. So Dianfa is the stronger technique of Anfa. So Dianfa is putting more pressure. So what I'll be doing is Dianfa, any areas if you're located with what you've just done, the Anfa and then tuifa and the Nifa. If you felt anywhere that's a bit tight, you could start working a little deeper. So you can start pushing down for a bit more pressure. She doesn't really like that.
A bit too strong, though.
Too strong. Or maybe just repositioning. Yeah. I'm finding a better position. But yeah. You could, if the animal doesn't like it, I would change technique.
Yeah.
That's I wouldn't keep pushing through because you don't want to lose rapport.
No.
Yeah. And if they start resisting what you're doing, it's going to make your job a lot harder. So even though our treatment package does say DNFR, if the animal's doing stuff like that, I wouldn't keep doing it.
No, when I went on that massage course, they always said, like, if the dog's uncomfortable with a particular thing, don't do it. Once they trust you, they'll let you do it.
Yeah, or they just don't like it.
Yeah, or, you know, but, like, the more you can gain their trust, then the more likely they'll let you do stuff later.
Yeah, don't bother, especially on the first session, because, you want to work with a compliant animal as much as possible. Okay. Alrighty, ready. So we've done, that was DNFR briefly, and we're going to do some NEFA again, which is the pinching of locally affected area of the hip and thigh. So remembering this is a package for an animal with arthritis, and arthritis is most prevalent, most common in the hips and the legs. Yep. So NEFA is just again pinching the skin. We're not working too deep yet, so you could just loosen up all that fascia around that area. This could take you a bit of time. She's a young dog, so hers is all fairly loose, but and ideally work both sides, but just for practicality's sake, we won't move her. Say she's got an issue with her right hip today. So you can work right down the leg. And then we're going to work up to NAFA, which is actually starting to grab the tissue, starting to grab the muscle. She's very toned, so there's not much you've got to put here. So you're just lifting the muscle slightly, and then it's a release. Cool, and again working all around the hip. Good girl. Wow. Oh, presenting to belly.
It's like a default move, isn't it?
It's always good to get right in the hip flexor there. So often a really tight spot. Not so much for an animal this age, and but older animals, those hip flexors. So you'll be doing NAFA around the hips, on the back area, the thigh. Cool. And then we're working up to some rofa along the back shoe. Cool. So rofas. Rolling. This is a nice in-between. So after you do some strong techniques, just coming back to something a bit more pleasant and gentle. Yeah. Is always good. And if you ever get a professional massage, you notice they often do that. They'll do some deep tissue work, then they'll back off a bit. So rofa, this technique's really nourishing. It's good for moving blood. It's good for building chi, especially if you're going along the back shoe. So we're hitting all those points that are there that we've covered off. Cool. So it's been a few minutes going up and down doing rofa. Yep. Cool. And then we're going to do some. You can as well, if you've come along any points or any areas that are tight or stuck there, sit on them and give them a bit of anfa, or if animal is comfortable with a bit stronger pressure, do DMFA. So that's just what we call ashi points. And ashi points are not particular acupressure points, they're just points you feel that are tight. We just call them ashi. Yeah. That's what that word means. It means it's not a specific acupressure point, it's just somewhere you've felt. Yeah. So you could just have a feel for any areas and put direct pressure on. And then we're going to do some yalfa of each limb. Cool. Within the natural kind of range of motion. So I always do, all 4 limbs. So yalfas are rotation. So clean.
You're not helping.
She's like half asleep. Good girl. That's me clicking.
I was going to say, I didn't think it was hers.
No, that's me. And then she slowly starts to, she's like, what are you doing? I'm sleeping.
You're very...
Maybe I'll show you in the front.
You're being very tolerant.
Very good.
I don't think I'd...
So I start small and then work my way out. So bracing above and below the joint. Because if you're just holding here, it's not quite mobilizing the joint as much as we'd like. So try and do all 4. Just bend, 30 seconds on each. So again, probably another, 2-3 minutes. So your massage will be over 20 minutes by now. And then what are we doing? So that's yalfa and then some bashenfa, which is the stretching. So holding above and below and just stretching out. Not too keen on her back, please. Oh, no, she's no.
You're okay.
Do all 4 limbs.
You're a good girl.
Young dogs are a little bit harder because they're just got energy. They're not normally in pain. So cool. There's Bashimba. And then we're going to do some unfa on some acupressure points. So often you'll do your acupressure at the end of the massage. Cool. So we're going to have a look firstly at large intestine 10 and small intestine 3. Cool. So large intestine 10. Don't know if you guys remember. Easier way to locate it is from large intestine 11, which we had a look at again today. And we're tuichun below there. So tuichun distal. Cool. And this point's good for nourishing chi, blood. Yep. So anfa, we'd just be pushing both sides if possible.
Do you mean both sides of the leg or both?
Both points, yeah. So bilateral.
Oh, yeah.
Each point is on both sides.
Yeah, I wasn't sure if you're pushing with your finger as well. No.
Oh, no, I'm just using my thumb. Yeah. But you could do like knuckle. Yeah. Cool. And then we'll go to small intestine 3. Cool. And I would be doing some unfar again here. Doesn't like her paws being pushed there. No. So this is proximal to the head of the 5th beta couple.
Leave it, Micah.
And just unfar pushing, and then we're going to have a look at gallbladder 34.
No, Micah. No, you're fine. She's just sniffing.
Gallbladder 34, which again we did today, biting the head of the fibula if you can. Cool. And then we're going ventral and distal. And just again unfar. And this point is good for tendons, ligaments, muscles. Cool. And then we're going to go down to bladder 60, do some unfar there. This point's good for back issues, back pain, paralysis in the hind legs. You could even push kidney 3 at the same time. So on the other side. And then going down to bladder 62. This point we have covered it off, but it's just distal to the lateral malleolus, just under the ankle. Again, it's also good for back issues. Cool. And now we've got the leg, we're going to start finishing up the massage now. We're going to do some, what are we doing? The unfa. So that's the holding and kneading of the digits. So I use normally index finger, thumb. Yeah, and this is really good for stimulating the nerves at the end of the toes there, at the end of the digits. It's really good for animals who have paralysis or, issues with the hind limbs, just to have that sensory feedback. Cool. So I'd be doing all the toes.
Yeah.
Okay. Especially the hind ones. Cool. Cool. And then some dofa, shaking of each limb. Cool. Again. So holding above and below.
Yeah.
Cool. And you just give it a shake before I can show you the front. Thank you. You did very well. And there's a treat in it for you. There's a good treat after this. Holding above and below.
She's a bit more willing with the front leg.
Yeah. Maybe just do it for 20 seconds each limb. Cool. And then, wonder how I should go with this. Again, finishing up. So we're going to do some chofa, sorry. Do you guys remember that one?
Yes.
So we're starting to get the more vigorous techniques out. So stronger techniques, moving the chi, moving the blood, stimulating the nerves, kind of warm them up. She's not sure what she thinks about this. Cool. And then we are doing some chafa on the back. The chafa is the fast one, so it's really heating. You're going to feel the warmth in your hands. So this one's really good for nourishing yang in the body because it's really warming. So it's good for animals who have digestive problems. I'd particularly be looking at doing it on the left side where with the digestive system. But do both sides of the epicurals, so either side of the spine. Warming that up. Cool.
You just don't make it easier to do your back, do you?
That's okay. Totally fine. We're almost there. And then we're going to finish up with some Ba Shenfa up on the neck there. So Ba Shenfa, to do it on the neck, you can see there, is you're grabbing from the bottom of the occiput. Yep. And you're pulling towards you. So it gives a bit of a stretch. Yeah. I don't know if you ever had your neck stretch like this. It's so nice.
Yeah, I think I can imagine it would be quite nice.
Yeah. And then you can get a bit more of a stretch by pushing them away. And it'd be easier if we're a bit more limited with space because we're recording and stuff like that. And if you have them doing a proper treatment, you have them in the center of the room so you can get 360 access. Or having them elevated on a table with 360 access. So you make this a lot easier for yourself, not having to be crouching in awkward positions as we find today. Cool. And finishing off again with Rolfa of the epicurals, which are either side of the spine, just to finish your treatment. What she seems to like. Yeah, and you could go up and down there for a couple of minutes. And that in total would be about 30 minutes if you did all that.
That was really good. I enjoyed that.
Yeah.
Make sure you send us the video.
Absolutely, yeah.
Hopefully I actually got everything.
That was really good.
And
You made it look